get started. So thank you for joining our group injury screen, focusing on the neck, the back, and some of the extremities. You're tuned in with Align Modern Health today, and we're just going to give you a little quick background on Align Modern Health. We're an integrative medicine practice that really focuses just to get to the root cause of any underlying condition and a symptom, not just the symptom. So we have a variety of specialties at all of our clinics. We have chiropractic medicine. We also have acupuncture, clinical massage therapy, and then functional medicine and clinical nutrition. If you need more information about any of these services, we can discuss a little bit of that at the end or get you set up with a free consult. I'm Dr. Catherine Emmerich. Again, thank you for joining in. I'm the chiropractor at the Kildare Clinic and the Vernon Hills location. I completed my undergrad at Bradley University, and then I got my chiropractic degree at National University of Health Science here in Illinois. I am certified in the McKenzie method, and I have quite a few classes in the dynamic neuromuscular stabilization, also known as DNS. So without further ado, we're going to get started on our screen. All right, so we're going to start with the neck, also known as the cervical spine. But before we get started with the screen, I just want to talk through the symptoms that we're looking for. So as we're going throughout the screen, we're looking for any sort of pain, stiffness, tightness, discomfort, numbness, tingling, differences on side to side as we're going through the screen. I know it can be a little confusing sometimes is this what this is supposed to feel like, or is this actually pain? Is it just stiffness? So I would like to start off with a little demonstration of what end range discomfort would feel like. So end range discomfort is when we've reached the end of the motion of our joint. The joint physically can't go any farther. So that should have some normal pressure feeling at the end. So I'm gonna have everyone have their hands straight out. And what you're gonna do is you're gonna lift your finger up as far as possible. So I have range on my finger and it's going all the way. This is the end. My finger physically cannot go any farther. And I'm feeling some pressure down in this part of my hand. So this is normal end range pressure. I would not categorize that as stiffness, soreness, pain, numbness, tingling, or anything that we need to be concerned about. So as we're going through the screen, again, we're looking for more true pain, discomfort, asymmetries, not that end range pressure, but using your finger is a good example to compare what you're feeling in your other joints. So we're going to start off with, like I said, the neck, and we just want to make sure that we have good range of motion going in. So we're going to start off very simple, just chin down to your chest as far as you can go. You should feel like a little bit of a stretch back here as we're going down. Again, that end range pressure is what we're looking for, but no true pain. Our next movement is going to be extending our head all the way back in this direction. Again, that end range pressure will be maybe a little bit of too much of a stretch in the front or a little bit of increased discomfort in the low back is what we're looking for. Next, we're going to start with our rotation. This is very important when we're driving, so we want to make sure that we all have full range of rotation. So head all the way over your shoulder this way, and then we're going to switch into the other side all the way over this way. Like I said, you would start to notice some limited range when driving normally, or you'd feel like increased pain in and along here. Our next one will be lateral flexion. So we're going to bend our head all the way this way. We don't want to cheat and bring our ear up to our shoulder. We just want to bring our head down this way. And then we're going to do the same thing on the other side. We're going to bring our ear to our shoulder, just like this. Again, we're looking for like pain and stretching on this side or compressive pain on this side. That would be something that is not normal. Our next two are movements that we probably don't realize our neck does, but they're very common. So we're going to start with what's called a retraction. So we're going to tuck our chin straight back like this, and our chin should be able to glide back. You can see I'm going straight back here. The final movement will be the protrusion, which is the opposite of the retraction, which is when we're going to jut our chin forward, just like this. Again, you can see you should have range going forward and then coming back. So that ends the range of motion for the neck. What I'm going to look at next is some nerve tension. So the nerves come down from the brain through the spinal cord into the neck. So we're going to look for nerve tension to see if sometimes the nerve tension could be contributing to the neck pain. So you're gonna hold your arm straight out to the side. And then you're going to bring your hand back this way. At some point, you could already be feeling tension here. If you have no nerve tension, you shouldn't feel anything at this point. As you pull your head away, this is what we're feeling. We're looking for like numbness, tingling, sharp shooting, increased pulling, coming down here, into the wrists, or even into the fingers could be a positive sign that we have some nerve tension. We're going to test a different nerve on the same side. So we're going to go back in that same position, but instead of bringing our hand down, we're going to bring our hand straight back. So same thing, we're going to pull our head to the side. In this one, we might feel more pulling coming into the thumb and onto the top of the arm as well. Again, that increased pulling, numbness or tingling would be a positive sign. The last one on this side is we're going to bring our hand, we're going to make the okay sign. We're going to bring our fingers down like we're touching our face and underneath like here. So one more time, I'll demonstrate that one because this one's a little confusing. We're going to make the okay sign, bring our elbow up and our fingers down so it'll circle over our eye. Perfect. Here we'd be looking for more pulling pain along the pinky or like the inner part of the arm here. So it's very important to do both sides for comparison. So we're going to go to the other side, do the same thing on this side. So remember how the tension felt on this arm. So we do this side. Again, hand straight out, hand back this way, pulling your head away. Again, looking for tension coming down the top of the arm. For the next one, we're going to have our hand straight back. Pull the head away, come back up. And then that final one is we're going to do the okay sign. Hand underneath, just like this. Same thing, this one's a little confusing. We're gonna make the okay sign, fingers come down along the side of the cheek and up like this. Again, these were nerve tension tests, so we're looking for symmetry from side to side. If we have increased pulling on one side or numbness on one side and not on the other side, that's something that we can definitely discuss in the clinic because these things can lead to larger issues or maybe things you already have going on, like elbow pain or carpal tunnel type syndromes can sometimes be triggered by all this nerve tension. Before we move on to the next section, I would like to do a quick stretch for the neck. Easy stuff that you guys can do in the car or at your desk just to kind of release some tension. So we're going to go back to that side profile again here. You can see, and we're going to go back to that retraction. So if you're going to put your hand on your chin, I want you to imagine that your head is on a shelf, and we're going to use our fingers and push straight back, just like this. So I'm not going down and I'm not going up. Everything's staying neutral, going straight back. We should be feeling a stretch up in the back of our head or even all the way down into where our neck meets our upper back. That's a nice stretch just to loosen things up. I picked this stretch because a lot of us work on our computers, so we end up leaning and forward and our chin comes out a little bit farther. So this kind of resets the posture and is an easy stretch to do in the car or at your desk. We're going to move a little bit lower into the upper back, also known as the thoracic spine. So again, we're going to start with rotation. Sometimes patients will feel like stiff and achy between the shoulder blades and just uncomfortable. So like I said, starting with some rotation, I'm going to scoot back so you can see me a little bit. And I'm going to have cross your arms across your chest. We're just going to twist to the side and then come back. And then same thing, we're going to twist to this side and then come back. Again, we're looking for increased pulling, pain, a lot of stiffness, asymmetry, side to side is what things we'd be looking for. So now we're going to do forward bending with our thoracic spine. So we're going to lean all the way forward, almost like we're doing a big stretch. And you can see my upper back is rounding out over here. This is what we're looking for to see if this causes any pain or discomfort. Now we're going to do the opposite. So I'm going to have you cross your arms across your chest like this. And we're going to lean straight back. A lot of patients get tripped up because they want to use their low back to create the movement. We want to actually use our upper back to create the movement here. Again, we're looking for like pain, discomfort, or the inability to do that movement. The last range one we're going to check is going to be the lateral flexion. So you're going to put your arms straight up over your head like this. And then we're going to lean all the way over in here. As we're leaning to the side, we could be feeling some increased pulling coming down in here, or we could feel some compressive pinching or really sharp, uncomfortable feelings on this side. Both of these would be positive if there's increased stretching or that pinching. So then same thing over here. This side, we're looking for symmetry to make sure that we're going equally as far. That's it for range of motion for the upper back or the thoracic spine. So I'm going to show you again like a quick home exercise while we're sitting at our desk to kind of stretch that area out. Like I said before, we end up becoming hunched forward normally within our desk. So we want to reset our posture. A lot of you guys are probably already doing this stretch at home, but I just want to emphasize the reps and the time that we're going to do this stretch to get the most therapeutic benefit. So I'm going to show you from the side view. And when we're sitting at our desk, we ideally want to be sitting up with good posture, like so. But this stretch, what we're going to do is we're going to do a posture reset. It's called the slouch over correct. So we're going to slouch all the way forward in like terrible posture. And then we're going to extend all the way back as far as we can. We can't go any farther. And then we're going to slouch all the way forward and then all the way back. And then after we've done about 6 or 7 of them, then we're going to rest in neutral. So just deep breath out, and you're just going to reset that posture to the midline where things are back lined up again. Like I said, a lot of you are already probably doing the stretch at home, but it's nice to just do it in like 5 or 6 reps rather than just that one quick stretch back. By going all the way forward, it really helps to go through that full range, and it'll give you more relief than just going straight back. Moving on to the lower back, we're going to start again with range of motion just to see how everyone's feeling. So I'm going to have everyone stand up for this one, and then you can see my side profile. So what we're going to do is I'm just going to have you bend down and touch your toes as far as you can go. So as I'm bending down, you can see my back's rounding over a little bit, and we're getting all the way down, touching our toes. A positive here would be if we're having lots of pulling in our hamstrings, which is the back of the thigh, into our glutes, pain in the back. Maybe we're having pain coming back up. Things are really uncomfortable. That's something that we can work at. So the next motion is going to be extension backwards. So everyone's going to put their hands right on their belt line here, fingers right above the butt. And you're just going to lean back as far as you can go, just like this. And again, we're looking, obviously we're not having as much range going backward as we are going forward, but we're looking for like pinching, sharp shooting, pain coming back up after extending backwards would be positive signs that things are uncomfortable. Our next movement is going to be rotation, so similar to that we did in the upper back. I'm going to have you cross your arms, and we're going to turn all the way this way. I'm keeping my hips squared forward, so I'm not cheating and using my legs and my knees to help with the motion. We just want to be looking at the lower back. So hips are forward, turning all the way to the side. Then same thing this side, hips forward, turning all the way to the side. Next, we're going to do lateral flexion. So this side bending, we're going to just go this way, all the way over, slide your leg down past your knee as far as you can go. Then we're going to slide down this way, leg past the knee. You can see how my low back is bending over to the side. Again, here we're looking for similar to what we're looking in the upper back, for lots of increased stretching, pain or pulling on the side going away, or maybe some compressive sharp pain on the side that we're going towards. Next, we're going to move the pelvis on the low back, on the lumbar spine, rather than keeping the pelvis stable. So this is going to check for side glide. So I'm going to slide my hips to the side this way. You can see I'm not bringing my upper body over. I'm keeping my upper body upright, and my hips are sliding over. So we're looking at my low back is sliding to the side. And then same thing, sliding to this side again, not bringing the upper body over, just sliding over this way. Perfect. All right. So that wraps up range of motion for the low back. Again, if anything's sharpshooting, numbness, tingling, painful, unable to do motions, that's something that we're looking to correct. We discussed the nerve tension in the arm when we did the neck. So I'm going to do some nerve tension tests in the lower back too, to see if we have any of those. So I'm going to move my screen over here so you can see my side profile. We are going to be seated in a chair, just like this. I'm going to be doing this leg so that you can see the screen better. What I'm going to do is I'm going to extend my leg all the way out, and I have my toe not pointed this way. I have it pointed back towards me. So your leg is all the way out, your toe is back towards you, and then you're going to take your hands, you're going to slide them down your thigh, you're going to roll forward. So all the way out, and then we're going to roll, slide forward. We're looking for pulling pain in the back, into the glute, all the way back to the hamstring, coming down the calf, maybe even into the bottom of the foot. We could be feeling this pain, or like numbness and tingling and shooting pain. But our biggest note is if this is a positive test or not is when we do the other side. So same thing on the other side, we're going to extend our leg straight out, toe pointed back towards you, and then we're going to roll forward, our head, our upper body, everything rolling forward, looking for that pain. So if things are feeling asymmetrical, that's an indicator that we could have some positive nerve tension going on. So now we're going to do a couple quick stretches for the low back and a posture, a correct posture demo. So with the low back, again, I think most of our target audience today does some sitting for a living. So I want to start with one that gets you kind of up and moving around. So similar to that range of motion that we just did, this now becomes an exercise. So hands straight on your back, just like this. We're going to lean back this way. So we're going to use our hands to kind of leverage our hips forward. So we're pushing our hips forward, leaning our upper body back, and then coming back up. We're going to do about 10 of these. We're just going to hold for 2 to 3 seconds here, and then come back up. Again, this should feel like a stretch across the low back. Some of it could be a stretch in the up down the wall too while we're doing this exercise. That's all what we should be feeling. So we've talked about posture quite a bit so far in this little demo, but now I want to talk about good desk posture. So I have my chair here. You can see this has a nice flat back, right? There's no low back support in this chair at all. And when we're sitting at a desk or sitting in any chair, we do need low back support, because with a flat back chair, we end up normally like slouching like this to keep our back flat up against the chair, which is the wrong direction. Correct posture is upright, nice and tall. So if you can see, if I'm sitting, even with my butt all the way back in the chair, there's a little bit of a gap here where my low back isn't supported. So we want to support that with good low back support. So this is a little roll that we have at our clinics. So I put it on the back of the chair. I'm going to sit all the way back in the chair, and then I'm going to put this down past my belt line. And then when I lean back into it, it promotes me in this more upright posture because I can't slump down. This roll is preventing me. So not only is this roll encouraging good upper back posture, it also keeps my upper body in better posture. So we're going to do this demo again with the upper body. So I'm going to take the roll out. And as my low back slouches, because it's not supported, you can see how my upper back slouches and my head wants to come forward. But if we put this roll back in with good low back support, again, right at the bottom of your chair, you're sitting all the way back. As my low back is more supported, my upper back has a greater chance of staying in a good position along with my head. So having good low back support directly affects the posture in the neck and the upper back. So if you're not sitting with good low back support in your chair, it's definitely something that you need to look into to correct even things like neck pain and upper back pain. Even if you don't have low back pain, this will make a big difference. So that wraps up the spine. we're gonna move into, for the remainder of the video, we're gonna move into the extremities. I don't have time normally to go through all of the joints, so we're just gonna hit the big ones. So we're gonna start with the shoulders. A lot of times patients will come in and they have this radiating or tightness pain, like it's in my neck, but it's also in my shoulder, or maybe you have pulling pain back here, or maybe there's tightness kind of across the pec in the front. And as providers, we need to determine if it's coming from the neck or if it's coming from the shoulder. So at an aligned clinic, they would go through that neck assessment, look for range of motion. We'll do those nerve tensioning tests to see if those have a play in what your pain is. And then we'll also do a shoulder assessment. So we're gonna start with shoulder range of motion. So you're just gonna, we can do this either seated or standing, whatever you prefer. You're gonna lift your arms straight up, just like this. Again, we're looking for symmetry. My one arm's not farther than the other. My hands are in sync. They're going equally as far back. I'm looking for pulling pain in the front, pain in the back. Is the pain happening before we get to 90, after we get to 90? These are great things to share with your provider. Next one, we're gonna do arms straight out to the side. So at our side, palms facing forward. We're gonna come straight up like this. Same thing, we're bringing our ears all the way to our shoulder. We're looking for symmetry. We're not wanting someone's arm to stop here and the other one can go all the way. We want this to be a pain-free, smooth glide. If we're feeling any catching or pulling or it's rough in there, that's also something that we need to have assessed. While we're sitting this way, I'm going to have you reach your arm all the way across your body, just like this. You could be feeling a little normal end range pulling here, but if there's sharp shooting pain or anything uncomfortable, again, something to have assessed. Same thing on this other side, just this way. We're going to look at the rotational component of the shoulder. So I'm going to have everyone reach their hand behind their head. You can see here that I'm reaching in between my shoulder blades of this hand. It's nice and smooth. And on this side, same thing, reaching in between the shoulder blades right here. Nice and smooth. The next one, we're going to reach behind the back. So I'll turn around so you guys can see it again. Same thing on the other side, right behind the back, nice and smooth. Some of you might have noticed I have a little bit of asymmetry there. We all have things that we can work on, and even the providers. So that's the shoulder range of motion. Shoulder range of motion, though, is not only in the shoulders. We also have it in the shoulder blade, which is this bone here that sits right on the back. So this should move just as much as the shoulder blade, and it helps move the arm as well. So we're going to start with shrugging this up, and the shoulder blade should glide up. And then we're going to pull our shoulders back. The shoulder blade should glide back and then come back down. So we're going to go up and then back and then down. I'll let you see this from the back view as well. You're going to go shoulder blades up and then they retract back and then come back down. This is a little bit harder for you guys to see on yourself because you can't watch your shoulder blades gliding. But when we assess in the office, we want to make sure that they're gliding in unison and not one is gliding higher than the other one or one is not moving as far. But we need to have that free shoulder range in the back as well to create all of the normal shoulder range of motion. So this is something that we assess. We already briefly discussed how the neck pain could be connected to the shoulder or even pain coming down to the wrist, but the upper back pain can also be connected to shoulder pain. So when we screen that middle back, this next assessment is a really good one that helps us rule out things like, is it the middle back or is it the shoulder? So for this one, I'm going to have everyone stand up. We're going to come over to this wall. If you don't have a free wall, you can do this one when you get home. But I want you to lean your low back and your butt and your upper back all the way against the wall. You can walk your feet out just a little bit so they're not flush up against the wall. I probably have my feet out about 12 to 18 inches off the wall. My head is flat against the wall, so everything's flat. My back's touching, my low back's touching, my upper back's touching, and my head is touching. So the whole spine is flush against the wall. If you can't do this, then this is a good starting point. This is something that we can work on. If you can do this, once we're here, We want to be able to bring the arms up, the shoulders to 90 degrees like this. Again, everything is staying flush. And then we're going to rotate our hands up like this onto the wall. Again, keeping everything flush. One more flat against the wall in this position. Again, we're looking for things like, is our low back arching off? If so, maybe we don't have the upper back mobility that we would have seen in the mid-back screen earlier. Maybe we can't get our arms all the way up or rotate our arms back because there's too much tightness or pulling pain or nerve tension in the neck or in across the chest here. So these are all things that if we can't complete that test or we have pain or discomfort are things that we want to have further looked into. I'm going to pass over the elbow joint because it's not as popular region for pain, but I'm going to go into the wrist because I know carpal tunnel is a very large issue today. So we're going to start with just some wrist range of motion. So we're going to have you wrist up just like this. We're going to go straight down just like this. Again, we're looking for like pulling pain, sharpshooting, maybe some compressive pain under the wrist here. Next movement, we're going to go all the way back. Yeah, all the way back this way. So this is neutral, and we're going all the way back. Now we're going to bring our thumbs toward each other. So straight in like this. We're not going forward. We're just moving slightly like to the side, just like this. Thumbs to the side. Again, we're looking for compressive pain in here or lots of pulling pain in here. Next one, we're going to do pinkies all the way out like this. So bringing our pinkies out like this. Perfect. We're looking for the same stop. The next two tests will be to look for carpal tunnel. So we're going to bring our palms together. Step one of the test. We're going to bring our hands down. As our hands come down, our elbows are coming up. So you can see the angle goes like this, and it just becomes a sharper angle as we're going down. This is compressing the carpal tunnel. So in here, we're looking for things like numbness, tingling, shooting pain, pulling into the hand. Things like this would be a positive indication that we have carpal tunnel. Well, now we're going to reverse the test, put our hands back together like this, and we're going to bring our elbows down with our palms, with our back of our hands staying together. Again, we're going to put our hands together and bring the elbows down. Same thing, we're looking for all those same symptoms in the wrist. This is another way to test for carpal tunnel. Last test we're going to do is I'm going to have you put your thumbs inside of your hands, like so. And then we're going to, this is our pinkies down here. We're going to pull our pinkies towards the floor. So you should see, as we're doing it this way, we're pulling our pinkies towards the floor. You could feel like sharp pulling, pain, discomfort in here all the way up to the elbow even. And this would be indicative that this test is positive. There's something going on that's creating all this increased tension in here. Similar to when we did the range of motion, but there's more added discomfort when you put the thumb in. That would be, just changes this to a positive test, which is why you can have pain-free regular range of motion, but not when you put the thumb inside. Two quick little stretches to do at your desk for the wrist are going to be you're holding your arm straight out. Take your other hand, pull back just like this. You want to extend your elbow so it's nice and straight. You should feel a stretch up in here as we're pulling our hand back. In this one, if it is painful, we just want to go to that point just before it gets painful so it feels like a stretch. We don't ever want to be putting stretches in a painful range of motion. So if you can't extend all your elbow all the way straight, you can have it a little bit bent and then just bend the wrist back and feel the stretch. As things loosen up, this should get easier. Same thing on this side. Okay, we're going to extend our elbow out and then pull our hand back like this. Perfect. And then we're going to do the opposite way. So we're going to have our, that's when we had our palm up. Now we're going to have palm down, pull the fingers up, and then hand back this way. This should be stretching the opposite side. So same thing, just like this. Yeah, and then up. Same thing if we're not able to extend the elbow all the way at the beginning because things are too stiff, that's okay. I like that's like in between seeing patients, I'll stretch my wrists out. Just quick couple minutes, like 3 or 4 stretches on each side, like 10-second holds or so. We're going to move on to the lower extremity. So we're going to start with the hip and the glutes because It's very closely connected to the low back. So if you have any low back pain, normally when you come in for a consult, we'll be screening the pelvis and the hips as well to make sure that there's nothing dysfunctioning going on in there, because the muscles are very overlapping in there. And normally if there's a dysfunction in one, the other one is compensating. So if we have something injured in the back, the hips and the pelvis start to compensate. If there's limited mobility in the pelvis, normally the low back will start to compensate because they work so closely together. I would like to start off with some range of motion for the hip. We're going to perform this standing today. So if you're feeling a little unstable on your balance, I'm going to have you use something for support. I have my chair right here that I'm going to hold on to. In the office, we can normally do this laying down, but there's no one to assist you today. So we're going to do it standing. So we're going to start off with flexion and extension of the hip. I'm actually not going to hold the chair because I will be blocking the camera then, but I want you guys to hold the chair if you're going to feel unstable. So what we're doing is we're going to bring the knee all the way up just like this, single leg balance. What I'm not doing is when I bring my knee up, I'm not rounding my low back over. You can see that my low back's staying perfectly stable and the range is just coming from the hip. This is what we want to check pure hip flexion. We're going to do the same thing with extension. So I'm going to bring the hip back. This is my hip extension. I'm not trying to cheat and lean forward and go all the way back like this. Again, we're keeping the upper body upright and we're just extending the hip back. Good. We're going to do the same thing on the other side, okay? So we're going to start with hip flexion. We're going up just like this. And then we're going to extend all the way back. Again, not compensating and leaning forward. Everything's upright, just extending the hip back. You should feel the glutes activated in here. We could be feeling a stretch in the front and the hip flexor as well, but we don't want to have painful range. And we're looking again for symmetry on side to side. Do we have equal range going both directions? Now we're going to do rotation from the front view. So again, we're going to hold on to our chairs for balance. What I'm going to have you do is I'm going to have you bring your hip up to neutral. So we're not out or in yet, but we're in neutral. And we're just going to rotate all the way across like this. And then we're going to come back to neutral and rotate all the way across. Again, we're looking for pain, discomfort, maybe numbness and tingling coming down the leg, pinching pain in the hip, all things we don't want to have. And then we're going to, again, we need to rest, put our foot back down, come up. And then we're going to rotate our hip out this way, all the way open. This could be pulling, pain, tightness in here. That would be a positive indicator. So same thing on the other side, okay? Lifting up, all the way across, coming back, and then lifting out all the way this way, looking for pain. So again, we're just looking, do we have the range in the hip? Same thing with this test. I'm not cheating and moving my upper back or my lower back. We're just getting the range from the hip because we want to check true hip range of motion. Like I had mentioned previously, when the hip range is compromised, sometimes the low back tries to compensate, which means it's working harder, which can be the generator of pain. So even though we have back pain, that limited hip range of motion could be causing it. Last thing in the pelvis that we're going to look for is good glute activation. So the glutes here on the side and in the back that help to stabilize the pelvis. So same thing, grab onto your chair here if we're feeling a little unstable. What I want you to do is I just want you to lift one leg slightly off the ground. I want you guys to all look at my belt because this is a good example right now of if my low back and pelvis are staying level. When I lift my leg up like so, I'm not hiking my hip up or my hip is not dropping down. Like as soon as I lift my leg, it's not dropping this way. As I lift my leg up, it stays nice and flat. My belt stays really level. No hiking, no dropping. If any of those things are happening, that can indicate to the provider that we have like an insufficiency in the glute. That is then we're compensating in the low back or maybe on the abdominals or in the hip flexor to try to stabilize where the glute actually should be working. So same thing on the other side, okay? Hold on if you need to. But again, we're going to look right at my belt line here. We're going to lift straight up. Good. And then come back down. Then lift up. So you notice I'm not hiking or dropping. If we're going to do any sort of athletic ability, like maybe we're a high school student in sports, or maybe we're a weekend warrior that's running, or maybe we're in the gym doing squats and lifting. We always want to make sure that we warm up our glutes before we work out. One of my favorite warm-ups is the good morning. It's really quite simple and it activates the glutes pretty quickly. So I'm going to demonstrate that one for you guys from the side view, because if we're not warming up our glutes before we're working out, again, we're going to end up compensating and creating pain down the road. So what I do, what the good morning is you're going to stand. I like to have my hands on my hips. My knees are slightly bent, not too bent, but not locked either, just a little soft bend in the knee. My feet are about shoulder width apart, just like this. What I'm going to do is I'm going to hinge at the hips. So I'm going to stick my butt straight back and then come flat down. So you can see here how my back is flat. I'm not rounding over and I'm not sinking it way down. Everything is nice and flat. So as we come back, my back stays flat. There you go. And in this position, you should feel the glute activation coming down into the hamstrings, maybe down into the calves a little bit, and then we're just going to come back up. So one rep would be you're going to put your hands on your hips or up above your shoulders, whatever's most comfortable. You're just going to come down just like this. You're reaching back like you're trying to touch your butt to the wall behind you, then come back up. We're going to bend our knees slightly, stick our butt back, touch, and then come back up. Just like that. It just gets the glutes warmed up, so they're going to be activated for any exercise that we want to be doing. The last joint we're going to look at today is going to be the knee. We see a lot of knee pain coming in through the clinics all the time. The knee is kind of like the middleman between the hip and the ankle. The knee's range of motion is not as great as the hip or the ankle. But we do want to make sure that its range is still working correctly so we don't injure things like our meniscus or tear things. So the two most common ranges for the knee are going to be a flexion extension. This is a little bit easier if you're laying flat on the ground or sitting down, but I'm going to do it in the chair just so that you guys can all see me. So what I'm going to do is I'm going to have you hold your leg up. You're just going to bring your knee or back or your calf back to your thigh, just like this. So as I have my leg up, the calf is coming back to the side and we're closing the joint all the way close. This is knee flexion. Again, we're looking for pulling pain in here. Maybe there's pinching and tightness back here as we're pulling this closed. That would be signs because you should feel relatively pain-free. The next movement is going to be the extension. So you're going to hold your leg straight out, just like this, all the way out. If you're laying flat on the ground, this is a little bit easier. Again, I'm going to just hold my thigh straight out completely. Again, we could be looking for pulling pain in here. Maybe there's pinching in the front, whether it's like bone on bone hitting, but we want to make sure we're able to open the leg up all the way, just like this. Lastly, the knee does have a little bit of rotational component. So I'm going to demonstrate it with my hand. So this is the bottom part of your leg and this is the top. So we talked about that flexion already with the knee going like this. And then the extension was when it was all the way open. So the rotation is going to be the bottom part of the leg just rotates just a little bit on the top part of the leg, just like this. So the tibia is rotating on the femur. So how we check for this is I have my patient hold on to their leg just like this, like we did before. You can see my foot in the video on purpose. So what we're going to do is I'm going to keep my foot completely neutral. I'm not moving my ankle. I'm keeping my foot stable and I'm turning at the knee and then turning back and then turning at the knee and then turning back. You can see this is kind of a subtle movement. The knee doesn't have a lot of rotation, but it needs rotation to function completely. So again, like if we're looking right here, we're watching for the movement happening here, even though you're going to see the foot. So we're bringing it this way, right? And then we're going this way. I'm not moving my hip to create the movement. And again, I'm not moving my ankle. It's just coming purely from the knee. We want to make sure that we can rotate in and out. Same thing on this side, okay? This is a little bit difficult of a movement, especially if we haven't done it before, so don't get frustrated. One of the providers at our clinics can definitely help you with this. So going in and out, again, looking for that rotational component of the knee. Lastly, we're going to screen the meniscus. The meniscus is in the knee. It kind of lives between the two bones as a cushion. It's one of the most common most common injuries with the knee. So a quick little meniscus test. We're gonna stand back up one more time. I'm gonna bring this down so you can see my knees here. So as I'm standing, we're gonna go back on one foot. So we're screening for this knee. This is the one I'm standing on. We're gonna bend our knee just slightly. And then again, we're gonna create that shearing rotation in the knee, just like this. I'm moving my hip and my pelvis a little bit to create more of that shearing pain in here. Yep, and then same thing, we're gonna switch and do the other side, bend the knee. A little bit of shearing pain. So as it's loaded, if the meniscus is injured, the compressive load from the body and that shearing will be uncomfortable. It can feel a little sharpshooty, it can feel grindy, just an unpleasant experience. Normally patients will either feel that on the inside or the outside of their knee when they're doing that test. So if you're having any of those symptoms, something that you can get checked into to see if your meniscus in your knee is okay. To wrap things up, I want to do one final exercise that's just good for core health in general. So I'm going to be sitting in my chair again here from the side, and we're going to talk about belly breathing. This is becoming more and more popular, especially in the athletic world, the weightlifting world, the yoga world, and we're trying to transition this to all of our patients so that helps stabilize the low back a little bit better. So normally when we take a deep breath in, everyone will go, and they're moving your chest. You can see my chest lifting up and down. When the chest moves normally with respiration or breathing, this is an accessory process and should only happen when we're hyperventilating, we're running really intensely, we're sweating and really working hard, we're under a lot of anxiety or stress. That would trigger the accessory muscles to come in. But that every day when we're sitting in our desks, going to the bathroom, doing housework, hanging out with our kids and our grandkids and our loved ones, we should be breathing with our belly. So I like to have patients put their hands like right here around the side. So just like this. And what we want to do is we want to take a deep breath in with our belly and breathe out. Then breathe in and breathe out. Can you all see how my hands are moving in and out and my fingers are coming together and pulling apart? So you can see the expansion of the air in the abdominal cavity, and then as I'm breathing out, it goes back away. So I like to tell patients that our abdominal cavity is kind of like a can of sparkling water or a can of soda. If you're picturing that can, when it's completely closed, it has a tremendous amount of structural integrity. Like you can't dent it, you could probably stand on it and the can's not gonna crack. But as soon as we crack the top of it open, all the structural integrity goes away. You could probably crush that little aluminum can with just your hands, even though there's fluid still in there. Same thing with the abdominal, like the core and the abdominal cavity. As we breathe in, the diaphragm will descend down and it pressurizes this cavity in here, which creates an outward force. And then as we activate our core, it creates an inward force, which makes the structural integrity of the core so much better than just trying to suck in and contract and brace. So if we can transition to belly breathing, it will help stabilize our low back hugely throughout our day while we're sitting at our desk, like I said, while we're doing housework. This breathing can be a little bit challenging. It's normally a little bit easier if you're laying down on your back, but for purpose of the video, I did it standing. So again, I put my hands around my hips here, just like this. As I take a deep breath in, my core expands, breathe out and it relaxes. Breathe in and breathe out. Good. Again, like you cannot see my chest rising up and down, and this is the beginning steps to having good core strength. We teach all of this to our patients when they come in for their first couple of visits. It's normally something that we cover, and it just helps to build on core strength. That is about all I have covered for today. I'm gonna open the screen back up for questions, so just give me 1 second, okay? Thank you for joining us. If you have any questions now, you can type them into the Q&A feature. These insurances on the screen are every insurance that we take here at Aligned Modern Health for a variety of our services. Sorry. We also do free 15-minute consults for all of our services, including acupuncture, functional medicine, chiropractic, like we talked about, and massage therapy and nutrition. So if you needed more information on any of those, if you reach out to us, we can do a free 15-minute consult, or we can just set you up a new patient visit.
Dr. Emmerich, we actually can't see your screen. If you wouldn't mind sharing your screen with us so we can see the Q&A, the contact information, and the insurances that Aligned Modern Health takes.
Of course, just give me 1 second.
Thank you. You know what, don't worry, go ahead and go to the Q&A and I will go ahead and find that slide and share it for us all. So please go ahead and open up the Q&A. There's some great questions there, and I will find the slide and share it for our audience.
Thank you. Okay, so I have a question about the belly breathing. So the question was, when you exhale, your belly goes in. So that is correct. As you inhale, take a deep breath in, your belly is expanding. And then as you exhale, it's going out. Yeah, so you should feel your hands move away as you breathe in and then come back towards you closer as you're breathing out. I have another question that says, do you recommend stretching every night and the morning to help with tension throughout the day? Yes, I definitely recommend stretching in the morning and in the evening. I also recommend stretching like midway throughout your day on lunch, and just spending like 5-10 minutes on your lunch or in the morning and the evening definitely really helps to keep things loose. But more importantly, if you're working from a desk, I really would recommend that you're getting up every hour, every 90 minutes, and just moving around, even if it's just to get up to go to the bathroom. Sometimes I have patients put a little Post-it note on their screen that says like on the hour, every hour, just get up and do a lap around their house or around the office, because even that little bit of movement will help make you feel better. I have another question about exercises for stiff neck and prevention. We covered a couple of these in the video presentation. We did the chin tuck with the retraction. We're going straight back. Remember, we were pressing our chin straight back. That is a good starting point. There's a lot more progressions to that exercise as well, and we can show those to you in the office. It's hard for me to give a perfect exercise for you without assessing you, so I don't want to give too many more besides that one, because that one's normally relatively a good fit for everyone. I have a question here about a tailbone that becomes sore after extended periods of sitting. Any thoughts that what could be causing it? So the tailbone is the end of the lower back, and it's also part of the pelvic cavity. So with pelvis, we kind of already briefly mentioned how like hip tightness or low back pain or issues with the pelvis are all very related. A lot of the muscles in that area are overlapping. So sometimes tailbone pain is easy as like postural stuff. Sometimes we need more hip range of motions. So it's hard for me to assess exactly what is going on with your tailbone without seeing you in the office. But again, like meeting with a provider closest to your location for that free 15-minute consult, even within speaking with you for that 15 minutes to hear about your case, they should be able to give you some great recommendations on what could be causing it and how to help correct it. It looks like that's all the questions. Oh, wait, just kidding. I see one more. It talks about IT band pain when bending forward. Again, this is something that the IT band is connected to the pelvis. So that exercise where I gave you called the good morning, where you're bending forward and activating the glutes. Remember how we talked about that the glute could not be working, so other muscles in the thigh could be taking over. So it could be potentially that the IT band is helping to stabilize that area instead of the glutes. But again, a little bit deeper of an assessment, because the IT band could be tight for a variety of reasons, could be discovered in that 15-minute free consult. I see one more question that talks about frozen hip. Frozen hip is going to be like when the hip's range of motion is really limited, for all of you guys that don't know. And they wanted to know if massage or physical therapy could help. Again, with like frozen hip, again, releasing the musculatures and allowing that range to come back is definitely beneficial. Massage therapy and physical therapy, or like the chiropractic rehab exercises that we could complete here, would ultimately help with frozen hip. Yes. I see one more question about yoga, but I don't actually see the question. I just see I have a question about yoga.
That's okay. The question about yoga is great, but it's really specific to that guest. So for the guest asking about yoga, we absolutely recommend a free consultation, because the forward bending movement question could be something specific to you and something specific that you're feeling. And that really does bring us to all the time that we have for today. So thank you to all of you that are still on the call for joining us. We really appreciate your participation. Thank you, Dr. Emmerich, for sharing your wisdom, your talents, and your knowledge. The motions we went through today, again, just as a reminder, are not necessarily exercises to do, as some of you have asked about in the chat and the Q&A, but are rather a screen for injuries. So they are different movements and motions to help you determine if possibly a visit to a medical professional is appropriate. If you have any further questions, or there is any unanswered questions, we absolutely would love to welcome you in for a free 15-minute consultation, either in a clinic or virtually via telemedicine, by calling 312-216-2452, or you can request one online at alignedmodernhealth.com. Thank you again so much for joining us today. We really appreciate your participation, and we hope to see you at the next Digital Doc. Cheers.